Health Officer Stephanie Garrity has led the Cecil County Health Department for the last 10 years. She announced her retirement this month, and she has agreed to join us in the studio to reflect on the past 10 years and look ahead to the future. Stephanie, thanks so much for being here.
Thanks, Allison. It's great to be back.
So, can you talk a little bit about the greatest achievements and challenges over your past 10 years?
Sure, I'd be happy to. I think one of the health department's most important achievements over the last 10 years was receiving National Public Health Accreditation.
Mm-hmm.
This was a voluntary process that put in play many procedures, processes, and putting together rules, documentation, things of that nature to show the national accreditation body that we have raised our standards to their level to become a high-performing local public health department. Things such as putting together quality improvement processes, standardization, things like that, I think showed that we reached that level, and one of the few in the state of Maryland that has done that. I think there's only 7 accredited health departments in the state of Maryland right now, and I believe less than 300 nationwide. So we're very proud of that accomplishment. And it was a Herculean effort. The staff really bought into the philosophy, and many of our partner agencies helped us along the way. So we're very, very pleased with that outcome. And we hope that that accreditation will afford us the opportunity to compete for funding in the future. We understand from many of the federal agencies that offer funding to local health departments that it's important to have that national accreditation to be considered for funding opportunities. So we definitely wanted to get involved with that.
So how would you say that that accreditation, how does the average Cecil County benefit from that?
That's a really good question, Allison. And I think one of the primary reasons that we decided to do this was to make sure that the quality of the services that we're delivering to the people of Cecil County are in fact quality and are based on science and offer best practices. Our funding is precious, and we wouldn't want to spend that money on programs and services that are not effective. So I think that's one way in which accreditation has helped the people of Cecil County.
Talk about some challenges that you faced.
I think I'll combine that answer with what the future may look like, if I may. Okay. I think one of the challenges of local public health departments and Cecil County Health Department over the last years is defining its role. I think for many, many years, local health departments across the country have been a gap filler. What I mean by that is if there was a lack of primary care docs in the community, the health department may have stood up a clinic to provide that kind of care. That has changed considerably with the Affordable Care Act. More people are insured. There are providers expanding care because reimbursement rates are getting better. And the role of the local health department is not so much, it's not needed so much as a direct care provider. Although we still provide some direct care, particularly regarding communicable disease outbreak as well as sexually transmitted diseases and things of that nature. But our role is changing, and we have to define what it is we're doing. So I look at my role, and I hope the new health officer will look at his or her role as a chief health strategist, someone who looks at the data, defines what issues the county is facing in terms of quality of health and well-being of the community, and then pulling together partners, funding to make those positive changes to improve health outcomes in the community. So, and many local health departments are struggling with that right now, but I think we're very well positioned to continue to fill gaps as needed, but to continue to play that role as planner, strategist, and partnering.
Okay.
Yeah.
In this time where we have an opioid epidemic,
Yeah.
What advice would you give to your successor?
I would tell my successor to keep fighting the good fight. This is not a sprint. It's a marathon. This took years to develop. It will take years to correct or fix. I would encourage my successor to encourage the community to keep an open mind, to embrace addiction as a disease and not a moral failing,
Right.
and to try everything that science recommends. Throw everything you can at the issue, both from a prevention perspective, treatment, recovery support, and public safety perspective.
Okay. Thank you so much, Stephanie. And
You're
thanks
welcome.
for your service.
Oh, thank you very much, Allison. Appreciate it.